Hi, this is Dr. Ward. I'd like to welcome you to Nursing 413, Psychiatric Mental Health and Nursing. This class is going to be exciting, interesting. It is definitely going to provide you with a different perspective on care of individuals who have alteration in mental illness. Mental health nursing is my passion, and I hope you will gain some insight into why I'm so passionate about it and why it is such a area that we need to pay attention to and be engaged in when we are developing ourselves as nurses who are practicing in any healthcare setting. One of my favorite things to say all the time is that if you're going to be a nurse, you're going to be a psych mental health nurse because you're going to see psychiatric mental health issues and patients in every setting. No person is immune of engaging with these types of individuals. So I want to start by talking about the purpose of this podcast. The purpose of this podcast is to give you an introduction to mental health prior to your course, to give you an opportunity to do some in-depth reading and preparing for class prior to the start, give you a general overview of some basic principles of psychiatric mental health nursing care and biological factors of care. Get you exploring a couple of definitions and terms and get you to complete a couple of activities related to this introduction. So, I will go over the syllabus the first day of class. We will start building. I will start building the Blackboard site. I've already started it, but it's under construction and not completely ready for full exploration. And I will be communicating via Blackboard and email with you regarding the class startup on Tuesday, May the 7th. So let's talk about the prevalence of serious mental illness in the United States. Because of the availability of data and information, and because a lot of these studies are long term and a longitudinal, it takes a little time. So, the last data and information collected regarding mental health was done in 2015. Basically, there is about 4% of the population who is diagnosed overall with some type of serious mental illness. The majority of those individuals are female, and the age range is from late teens, like 18, to late early adulthood, 26, 27. There are definitely more women who are impacted than men by mental illness, and Caucasian Americans, white Americans are most commonly affected. However, certain disorders are more certain disorders are more common in African Americans because of the saturation of the diagnosis within the population. Um, there are basically three roles that nurses play. First, there's the generalist, and that's just an RN who's got her basics and has some studies and exposure to mental health nursing in school, and her focus is on assessment, diagnosing, planning, implementing, evaluating nursing care for individuals in general. And she is aware of the most common nursing diagnosis for individuals who have alteration in mental health, and she is able to provide care in any setting for this client. The second one is the nurse practitioner, or the psychiatric mental health nurse practitioner, and this is an advanced practice nurse. And the difference between her and the basic nurse is basically they can prescribe medications as well as do some psychosocial therapy on individuals or clients who are affected by mental illness. Finally, there is the advanced practice nurse who is doctorally prepared, that is your DNP or your PhD, and they are engaged in either converting research to practice and implementing that into practice settings, or actually doing research in the area of mental health. So there are options. There's definitely a career trajectory for the nurse who is interested in psych mental health nursing. But as I said before, all of us as generalists have to have some knowledge of care for this type of client. So when you talk about mental health, you have to think about us being on a spectrum or a continuum, with some of us being on the extremely healthy side where we are well, things are right, emotionally and behaviorally we are stable. And then there's the unwell side where we're unhealthy, we're not coping effective, things are not stable, our behaviors and our emotions and our moods are off balance. So we kind of move this way, and we can stay on this healthy side as long as there's nothing that's pushing us beyond our ability to cope, or a crisis that's challenging our normal coping skills, or a challenge that is really stressing our normal defense mechanisms. But if we have something that challenges our normal coping skills, something that challenges our normal defense mechanisms or our resilience or ability to bounce back, then we move more to the mental illness spectrum, where we actually are starting to have some real issues with functioning in life. Mental illness is a psychiatric condition, and basically it'll disrupt the person's way of thinking, the person's mood, the person's way of behaving, and their ability to interact or relate to other people. So when you're having those kind of issues, then it's falling or pushing into the category that we look at or call mental illness or mentally unhealthy. And then you can have serious mental illness or serious alterations in mental health where those issues become chronic, and it's harder and harder for people to control their behaviors. So we walk around all the time and we say stuff to people like, girl, you obsessive compulsive, girl, you're passive aggressive, man, you're bipolar. We walk around in this country and we use labels quite a bit as it relates to somebody's mental or emotional state. However, it is a good thing that labels that people in public give you cannot is not what deems you as having an alteration in mental illness or mental health. So there is criteria to diagnose a mental illness, and there are 4 criteria, and those 4 criteria have to be present in order for someone to be diagnosed with a mental illness. This is a testing concept, and so you need to understand that people who are diagnosed with mental illness, that are formally diagnosed, they are showing some dissatisfaction with their life, they have ineffective relationships, they have ineffective coping, and they lack personal growth. I always say this as a running joke. I am a very, very, very obsessive person about particular things. I like organization and structure and neatness. However, I get along with people well, I can cope, I'm growing every day, and I'm happy with my life, and I don't take medication. So I always say that as a running joke. Um, you cannot diagnose me formally with any mental illness because I do not meet the criteria. So when we talk about the criteria for mental illness, we have to think about the factors which influence uh, us to have a mental illness, or which have an impact on our mental health. So one of your assignments that you will be turning in on the first day of class is a list of 10 factors which influence mental health. So write down a list of 10 things that you think influence mental health. Focus on some things biologically that might influence, some things socially that might influence, some things psychologically that might influence. But focus on writing down 10 factors which influence mental health. Now, we were talking about criteria for being diagnosed with mental illness, and I want to show you this. This is the Diagnostic and Standards Manual of Mental disorders. And this is published by the American Psychiatric Association. And the benefit of this is that this provides us with some general nomenclature, standard characteristics or signs and symptoms of disease, and really helps us in looking at the presence of mental illness in an individual. So, in order for a person to be formally diagnosed, a physician will look at that individual's assessment. They will look at the signs and symptoms, how long the signs and symptoms have been present. They will look at associated signs and symptoms or characteristics. And once the person has demonstrated those for the length of time or the number or the categories, then they are formally diagnosed with a disorder like bipolar disorder or schizophrenia or one of those. So this is important. Please go to the American Psychiatric Association website and explore what is the DSM-5 criteria, so it'll clarify for you what this is. This is not used by nurses for diagnosing, but it does help us identify signs and symptoms and nomenclature. So it is a very good book. So once they identify the criteria, then they put the patient on what they call a multi-axis system. On an axis, the southern and the northern get confused, so axis, A-X-I-S. They put them on a multi-axis system, and they put them on 1 to 5 axes. The first axis is where you would identify if they have a clinical syndrome or disorder, for example, like schizophrenia. On the second axis, if the patient has a personality disorder or a mental retardation, you put it there. The third axis, they put any medical conditions like hypertension or cardiac artery disease. The fourth one are psychosocial environmental stressors like problems on the job, problems in a marriage, drinking, or stuff like that. And then finally, on a scale from 0 to 100, they identify the patient's ability to globally function in terms of their thought process, their behaviors. And so we're going to do an application exercise on putting someone on an axis in class on the first day. So the next and the final thing that I want to talk to you about in this introduction is to talk to you about relevant theory for nursing practice. Now, there are a lot of theories. You've taken psychology, so there are a lot of theories that are associated with how we determine how we manage or treat individuals who have alterations in mental health. One of those is called cognitive theory, and it says that basically the way that we behave is determined by the way that we think and the assumptions around the way that we think. For example, when somebody says the director of the nursing program, people automatically think, oh, she's mean and you got to be careful because she might put you out of the program. But that's their thought, and based on schemata of how they've seen people use power in the past, they automatically label me as being somebody who is mean, intimidating, and just waiting to find a reason to put them out of the program. And that's so far from who I am. The other thing is behavioral therapy. You've heard of Pavlov and Pavlov dog and how he modified the dog's behavior. Well, behavior therapy is the same thing, the same theory that we use in people and human beings, where we actually take we teach behavioral responses and then we modify those behavioral responses. And then the next one is interpersonal theory, and this is one of my favorite. Harry Sullivan is the person who came up with interpersonal theory, and he says basically that relationships, social experiences, and working with other individuals help us get our cognitive as well as our behavioral needs met. And so Hildegard Pavlov is a nursing theorist, and she took that and used that theory to talk about the nurse-patient relationship and to talk about how different phases of the relationship allow us to manage interpersonal relationships with patients and contribute to their care and their well-being therapeutically. So this is the podcast number 1, your introduction to mental health nursing, and I'm going to follow up with podcast 2 and 3, defense mechanisms, and podcast 3, behavioral and cultural implications. Thank you.